Let's talk about whether weight loss can actually cause coccyx pain or tailbone pain. I'm Dr. Patrick Foy, and I am an MD or medical doctor. I'm the director of the Tailbone Pain Center or Coccyx Pain Center online at tailbonedoctor.com. I'm here in the United States, and one of the questions that comes up sometimes is that after weight loss, people can have new onset or worsening of tailbone pain. Whether that's after weight loss surgery, such as a gastric bypass or a gastric sleeve, or more recently with some of the GLP-1 weight loss medications, such as Ozempic or Mounjaro or Wegovy. And people will often say, hey, I lost 50 or 100 pounds or more, and lots of things in my life are much better. But now I have this tailbone pain that I wasn't having before, or it was never this bad before. And let's talk about a few of the ways that that can happen. So first of all, if we look at this model of the pelvis, and here in the we can see that when somebody sits, they're putting a lot of their body weight onto the sit bones at the bottom of each buttock here on the right and left side, and not quite so much on the tailbone at the midline. And partly the entire pelvis is a little bit elevated by the gluteal or buttock muscles and tissue, including fat within the area. So they're not quite sitting as directly onto the seat. But then when they lose some body weight, including losing some of the body weight in the gluteal or buttock region, the tailbone now is that much closer to the chair that they're sitting on. And they may have never had tailbone pain before, or it may only have been very, very mild or uncommon, infrequent. But now all of a sudden they're having that tailbone pain. And often what's happening, if we look at another model here, we can see that as the tailbone is here at the lower end of the spine, we can see there's that little bit of clearance between the tailbone and the chair that you're sitting on, that we're not putting much of our body weight directly onto that. But as the pelvis overall shifts or sinks a little bit lower because you've lost some of the gluteal body weight, then what happens is that this lower tip of the tailbone now starts to contact the chair and make direct contact in a way that had not been making before. So if there's a bone spur there, for example, which is one of the common sources I see in patients who travel in to see me for tailbone pain after weight loss, often there may be a bone spur there. There's special x-rays and MRI and things that can be done in a very particular type of way in order to properly do the imaging to show that. A standard MRI often will fail to show it. A standard CT often will fail to show it. And even standard x-rays, if they're not done properly with a cone down collimated view, will fail to show it. But anyway, there are particular tests that can be ordered in the proper way, and also carefully on the physical exam to evaluate for this and other findings that can cause tailbone pain after weight loss. If you're interested in more information on tailbone pain, certainly on Amazon, you can always grab a copy of my book, Tailbone Pain Relief Now, or if you're interested to come and see me in person or find more information, free videos, etc., you can find me online at tailbonedoctor.com. Okay, that's all for now on tailbone pain after weight loss. Bye-bye.